Okay, so my name is Joanne. I'm the nurse that's been at Berry House most recently, and I was asked to do an in-service on some personal safety things and some hand sanitizing and hand washing and all of that sort of stuff. So, the first thing that we're going to talk about is hand washing. Does anybody know when do we use hand soap versus hand sanitizer? Okay, really there's no difference between them for the most part. Most of the time now they're suggesting that we use hand sanitizer, actually. They find that hands are cleaner and more sanitary after hand sanitizer because most people don't use hand soap for long enough. So when we wash our hands with soap, we're supposed to wash for a minimum of 20 seconds with friction, rubbing for 20 seconds. Well, if you've ever looked at your watch while you're doing that for 20 seconds, that's kind of a long time, you know. Hand sanitizer only needs to be about 15 seconds or until it's dry, okay? So most of the time people will get a lot cleaner with hand sanitizer. There's two big differences though. One would be if your hands are noticeably dirty. So you're just chopped up some chicken or you helped somebody in the bathroom and oops, something got behind your glove or whatever. If you can look at your hands and you see material on your hands, you have to use the soap. Otherwise, you're just kind of rolling it around with the hand sanitizer, okay? The other difference would be is if someone has C. diff in their stool and you happen to be caring for them, or if someone in the home that you're there for or whatever has C. diff, hand sanitizer will not kill C. diff. So you have to use soap and scrub well, okay? Any questions about those?
What is C. diff?
C. diff is a bacteria that grows in stool.
Huh?
So people will end up with profuse loose stools for days and days and days and weeks sometimes. But it's fairly contagious, and the alcohol in the hand sanitizers won't kill it. It needs to be used a soap with that. Okay?
We've had clients on our caseload for supportive home care who have had C. diff, but we don't do any hands-on care.
Sure.
But just so you know.
But just being in the home.
Yes, yes.
You would want to make sure that before you're leaving the home that you're washing with soap and water and not just using the hand sanitizer, because you know that C. diff can be everywhere, you know, in the patient's bathroom, in their kitchen, on their recliner, you know, those spores can settle anywhere. So to make sure to use soap and water. Okay?
So what about leaving? You wash your hands,
Right.
but then you gotta touch the doorknob in order to exit
Right.
the residence, so what is the protocol for that?
I know. A lot of times I use a paper towel. You know, I'll say I need to
A lot
wash
of our
my...
clients don't have paper towels.
Yeah. Do you guys take bags in with you
No.
at all or any?
No.
Okay. That was another question I wasn't sure on, because that opens up a whole nother Pandora's box if you guys are taking things into a client home, because you have to be careful that you're not taking any germs or things with you then, you know. So
So what do? Take a paper towel in your pocket, and that's what you use after you get ready to leave the client home to open the door?
it's a little different, I think, because I usually have my nursing bag with, you know, blood pressure cuff, stethoscope, all that sort of stuff in it. And so in the outer pocket of that houses my soap, sanitizer, and a bag of paper towels, you know, so that I don't even need to go into my bag, because bag technique is a whole nother animal as far as infection control. So yeah, otherwise wash your hands, leave the home, and then hand sanitize and just wash the next time you get somewhere, you know. But we have to do the best we can. Sometimes it's the realness of being in a home environment that we can't control everything, you know.
Well, perhaps that's also the reminder, because we do a lot of cleaning with people, that, you know, if we're occasionally just cleaning their doorknobs.
Yeah, that'd be an
might not
excellent
be a bad
point.
idea, because I would guess that our folks don't wash their hands most of the time.
Right.
That would be an excellent thing that you could do if you happen to be there cleaning up a little anyway. Is to swipe something over the doorknob before you even go to leave. Then you know the doorknob's clean. Yep. Okay. What about wearing gloves? How often do you guys put gloves on?
I do to clean, like in the bathrooms and that.
Okay.
I always have gloves in my glove box in my car.
Okay. It's been interesting because I've done hospice and home care for almost 20 years to see the vast differences in how people choose and end up doing that. Some people put on gloves like the minute they walk in the door and wear them pretty much all the time for all patient contact, which I think is a little overkill. And then some people will be doing pericare and all sorts of stuff and not putting gloves on, which is, utterly horrifying. But, so where is the line there? Obviously, we would want to put gloves on if we're cleaning a person's home and their bathroom and things like that. We would want to wear gloves. If we're doing any kind of patient contact or personal care with anything that has to do with their peri area, we want to have gloves on. Anything with oral care, we want to have gloves on. Casual contact, I think sometimes it's obtrusive to have gloves on if you're just shaking their hand, and talking with them. I don't think we need to wear gloves. But what about masks? Do you guys carry masks with you?
Can we go back just
Yes.
a second, please?
Mhm.
So what a lot of our staff do is med observations.
Mm-hmm.
So a lot of our folks have blister packs.
Those
And
are.
everybody's double touching those blister packs constantly.
Mm-hmm.
What's your advice?
As far as gloves or
Yes.
not? Well, I think that the regulations state that we're supposed to have gloves on.
Not for home care, for our kind of home
Not
care.
for your
It's just
kind of home care.
supportive home care.
Okay. I don't put gloves on when you handle those. I don't know if it would be worth a swipe on the blister side with some sort of wipe, Clorox wipe, or not, especially if the patient's handling it often. I would not do anything to the back side where the meds come out, because I would be afraid that we don't want them to have some Clorox or anything or whatever we're using a wipe with on that side. But if you want to do is give a swipe on the blister side, especially if you're in some of those more questionable homes where they haven't washed their hands in a week. Yeah. I don't know that I would wear gloves there. Okay. I'd wash my hands when I was done, but I wouldn't wear gloves while I was helping them with it. Okay. One of the next things that we were supposed to talk about is some respiratory hygiene or cough etiquette. I think we all teach our kids that they're supposed to cough into their sleeve, right? They don't have a Kleenex nearby. Otherwise, you're supposed to take a pile of Kleenexes, cough into it, blow your nose, do whatever you need to do, throw it in the garbage. Exactly. I do that all the time, right, into my shirt. Cough into the inside. And then when you're done, you wash your hands or use hand sanitizer. Okay. That would be an acceptable reason to use the hand sanitizer. You wouldn't necessarily have to use soap and water just for a cough. Okay, as long as there's nothing visibly soiled on your hands, you can use the hand sanitizer. Okay. One of the things I even do, like when I go to Berry House to do assessments, is I wipe down the desk and the patient chair that they sit in when I'm there. And then anything that touches the patient repeatedly that might be used on somebody else, I have to wipe down between uses, okay? Because I don't want to pass things from one person to the next. So I heard you say that you don't necessarily take a bag or anything in with you, which is a good thing, I think. The caveat with that is that you're not necessarily taking in, though, then soap and paper towels or hand sanitizer. Is that correct? Okay. So I was just pondering that, if that might be, because I've been in homes where they don't necessarily even have soap, or I'm using Dawn dish soap to wash my hands, or, they have a hand towel hanging next to the sink that's all crusty and dirty. And and how do we want to make sure that, we are being protected as well as educating them well on, proper hand care. So maybe Bev and I will have to talk about that a little bit. But because the other thing that I usually keep in my bag is I have some masks. So either if I'm sick, or if I've got the sniffles, I don't have a fever, I don't really feel that terrible, but I might have a little something that I don't want to give to anybody, I can put a mask on. Okay? Then I can't pass anything on. The other thing is if I go to the home and the family all tells me that they've been really feeling horrible for the last several days and they've been coughing and everybody's sneezing and sniffling, then I have the option to put one on, you know. And I had thought at one point that patients would be have their feelings hurt maybe if I had a mask on, you know. What I found is that many times patients and family thank me for having a mask on, you know. I'll say, I really don't feel like I'm too terrible. I think I just have a little bit of a common cold or something, but I'm going to put this mask on just to make sure I don't give you anything. They're like, oh, thank you, you know. And so it really doesn't impact my ability to care for them at all, and they seem to appreciate that I'm trying to keep them safe. What about like gowns and stuff like that? Do you deal with, oh, sorry.
Back up. Where do you get those masks?
We can get them anywhere. I think they order them from Medline. If we can buy them on Amazon, they have them at Walgreens.
Oh, Walgreens has got them.
They have small boxes of them. I think if you're going to order a bigger quantity, you could do Amazon and get a case, you know, and then divvy them out in a plastic bag or something.
And I quite agree with what you said, because we did have a client who called in who said, I really appreciated the fact that somebody wore the mask because they don't want to get sick. I go around saying that, don't come near me if you're sick, I don't want that. So.
Right. Yeah, it wouldn't be a bad thing to have even in a bag in your car just to make sure, you know. Not only do I...
But even when I've gone to the hospital, you know how they got like, is it like the blue and the white side? It's like, okay, well, it doesn't give me instruction. What side is supposed to be for the
It really
face?
doesn't matter.
It doesn't matter?
It really doesn't matter because the filter part is through the middle, okay? So a mask worn the wrong way is going to give you just as much protection as the other way, okay? Usually the blue and the white, if they're different colored, usually the white side would go towards your face, okay? And the blue would be on the outside, but it really doesn't matter. The other way that you can sometimes tell is how the string is attached on the inside. Usually this would be your inside that goes towards your face.
Makes sense.
Okay. So that's masks. What about like gowns? You guys putting on gowns in your patient care environments? Usually not. Okay. We'd have to talk about the C. diff thing though, because clothing transfer has a fairly high rate of contamination for C. diff, especially if you're changing like bed linen that's soiled with C. diff. Those are cases where sometimes it's not a bad idea to have a gown on before we remove the bed linen to be washed. C. diff is just a bad one. It's a pretty high rate of contamination, so we'd have to chat about that. The other thing that we need to talk about a little bit is sharps safety. Now, you guys aren't giving any medicines via syringe, right, with a needle. But some of the patients that you take care of have blood sugar checks or AccuChecks, and they give themselves insulin or whatever. I think the biggest thing safety-wise for that is that if a needle has been used on somebody, they don't hand it to you. Okay, so they don't say, oh, I checked my AccuCheck, here's my needle, can you put this in my sharp spin for me? You have them set it down first, okay? Because hand-to-hand transfer of a sharp is one of our biggest risks of being an accidental needle stick, being poked, okay? I've had people, you know, they give themselves their insulin, oh honey, can you run this to my sharp spin for me? And they're handing me their needle. And if they cough, sneeze, whatever, you know, they could be jabbing me while I try to grab it from them. So usually I bring their sharps container to them. Here, put it in here. Okay, that would be the easiest thing to do. Okay, if for some reason that's unable to happen, then they need to set it down on a flat surface so that you can pick it up to put it in the sharps container. Does that make sense? Okay. I don't know, because you guys aren't really educating on them checking their blood sugars or giving their insulins or anything like that, right? I just think of all of the times when I go into a patient home and I see them do things that are definitely not by the book. Um, and I'm not sure that it's your place to be fixing that necessarily. Am I correct in that, Bev? I mean,
Yeah, I think we have a couple of people who are doing the finger picks
Mhm.
that you guys are seeing regularly.
okay. I mean, we can talk talk about it a little bit, but a lot of times these people that have been diabetics for a really long time, it would be unlikely that we're going to change their practice, you know. Um, so technically, they should be washing their hands or using a little bit of alcohol before they poke their finger. So many times in some of our more unclean homes that haven't washed their hands in a week, they're checking their blood sugars without ever washing their hands or doing anything like that, which could be impacting their result that they get for their AccuCheck. But like I said, it's going to be, a little unlikely that we're going to fix that problem. That's who they are, and that's okay. We need to meet them where they are,
You could even have those alcohol swab pads like Gary does
Mhm.
on Park Ave. Gary at least has the little alcohol pads, but
Yeah.
Ken doesn't.
Really?
Well, and there's
Yeah.
been some controversy even about the alcohol wipes in recent years, that if you use an alcohol wipe and check the AccuCheck too quickly before the alcohol has had a chance to dry, it could vary the result as well. So if they're using the alcohol, they want to use the alcohol, let it dry for a couple seconds before they do the poke. Or they can wash with some soap and water. For a lot of older people or people that are more frail, often have the chilly hands that are kind of cold. Sometimes they have a hard time getting blood with their AccuChecks. Washing their hands with some really nice warm water for a few seconds will improve their ability to get blood via AccuCheck, like almost instantly. Okay, if we can warm up those extremities and get the blood flowing there for them. Okay. Sterile instruments and devices was on our list, and I guess I'm not positive what that means. I do know, at Berry House, they have the Chlora, the antimicrobial wipes, and that's what I use when I'm, doing patient care assessments. So I'll wipe the chair down with that. I'll wipe off the stethoscope with that. In a patient home setting, if you were taking anything in with you, typically we would want to make sure that we're setting that down on a safe surface. Okay, so when I go into a patient home, this bag has never seen the floor. Okay, it has always sat either on a chair or on a hard surface. If there's things in the home that are kind of creepy, and even the table is sticky, I carry in the bag some wipes. These are like the antimicrobial wipes that I can wipe off the table before I set my bag down. I also carry a pile of garbage bags. Okay, garbage bags are my friend, and I use them a lot. Okay, I use them sometimes in creepy places to set my bag down on. So when I go in, I'll set my garbage bag out, and then I can set everything on there that I might need for that visit. Okay, I can set my stethoscope on there. If I know I'm going to change somebody's dressing or whatever, the dressings go on top of the garbage bag. Okay, so that I know that this is, it came off of a fresh garbage bag roll. Could there be some germs on there? Yeah, maybe, but it's unlikely there's going to be any pathogens that I would carry from that. Okay, and then when I'm done, I can roll it up and throw it away before I leave the patient's home. Okay, so the same thing would be with your jacket in the wintertime, or your keys, or your phone, or whatever you happen to be carrying in with you. You need to be mindful of where you're putting that down and what could leave with you. Okay, so my jacket hangs either on a doorknob that I know might be clean or on the back of a hard chair. Try not to be putting it on a couch or a recliner or anything like that. If they have bed bugs or any other things that creep and crawl within their home, we can then carry them home with us. Okay, it's way less likely that will happen with a hard surface. Okay. I actually had a nurse in hospice that took bugs home from somewhere. And that was not cool. It cost her thousands and thousands of dollars, so to get rid of them.
Do
So.
your patients get offended when you pull out all that paraphernalia?
No, especially if we're doing it when we first go in. And I know with our team for home care hospice that all the nurses do it now. You know, we're all for sure setting it on a hard surface. And so even if I don't necessarily take out the bag, and this I only use the garbage bag for super creepy places where I know that a wipe with a sanitizing wipe isn't going to take care of whatever's on the table. And I think we might have all been to places where, you know, you go to set your stuff down on the kitchen table and it's like, oh my gosh, like I need an SOS pad and, you know, 5 minutes of elbow grease to get this clean. So then I'm not going to just set my bag down on there. Otherwise, a lot of times, if it looks like they just washed the table and I know that they're really clean and tidy, I might just set my bag on the table. Okay, or I would use just a wipe and wipe down the table. But I'm going to choose always the table over anything soft or plush. Okay, because I can see what's creeping on the table for the most part and not necessarily what's elsewhere. Okay, I think that's all I have. Were there any other questions right now?
Eric, from the perspective of a case manager, do you have some thoughts or some questions that might pertain based on your practice?
Just a lot of the stuff she covered today is a lot of things that we would definitely have to kind of work with ourselves as we go into the homes to be more mindful of how we could spread one visit to another, the kind of contagions that are in the programs that we go to.
Mm-hmm.
So just having that awareness of what to use when we go from one situation to another, or if we assist our clients, because sometimes we do go to the doctor with them and things.
Mm-hmm.
And the awareness is important.
I noticed you have a binder thing there. Even my clipboard that I take, I will often, when I'm using my hand wipe at the end or my sanitizing wipe at the end of my visit, I do the back of the clipboard just to make sure. Because we don't know if you go, you know, 5 places every day for, you know, whatever, weeks and weeks on end, can you imagine what's on there? You know, we often don't think about those things that we can't see. And all those germs and pathogens like to hitch a ride and be carried around with us. And I am certainly not a clean freak. My kids are out and playing in the dirt all the time. Dirt definitely has its place, but it's our job to protect the next patient or client that we're going to see, to protect them from anything that we may have carried with us before. And we don't want to take anything to our home, you know, to share with our loved ones. So,
would you have any recommendations on vehicles, transferring clients from one location to another? What we can do to protect the next person to get in the car?
Right. The biggest thing, in my opinion, would be to wipe down the inside of the hard door. If they're using the door handle and things, it would be worth a wipe. I would even go so far to venture that it wouldn't be a bad idea to put a chuck pad on the seat, and then just, you know, if that becomes the norm and every time they ride with you, you have a chuck pad on the seat, because if somebody has an accident on your seat, you're going to be looking at some pretty lovely cleaning that could happen there.
We haven't had that since we don't transport elderly. It's not that I'm aware of, but I know that when we were transporting elderly, it was an issue.
Yes.
On more than one occasion.
Yes.
And we actually had those truck pads at that point in time, but we don't do that much anymore.
That would be my only thing that I could think of, but otherwise.
I should probably get one for Maddie.
You probably should. Yes. Her in particular, yes. Also seems to me just listening to you, I think it makes sense to have like a baggie, and in that baggie have the mask, maybe the gloves and the hand sanitizer, so if and when you need it, you got it.
Mm-hmm. Yep.
And then keeping all your stuff in your own pockets and not putting it anywhere in the apartments.
Mm-hmm.
What about laundry? When you're doing their laundry,
I would wear gloves.
you would wear gloves?
Mm-hmm. Because you don't know if there's been any type of secretions or any, you know, urine or otherwise on there. It wouldn't be a bad idea to wear gloves. Just as you throw it in the wash, it should be more okay when it goes from the wash to the dryer, although there's been recent studies about that I can't even read anymore because it creeps me out about how much stuff survives the washing machine, germ-wise. It's a little horrifying.
Well,
So-
isn't that because it's not on hot?
No.
Even
No.
on hot, it's not getting it?
Mm.
Really?
They're saying you need to bleach things if you want it to be sterile or sanitized. Yeah. Anyway, I would wear gloves to put things into the washer. I don't know that I'd worry about it too much from washer to dryer or to help with folding, but just when we aren't positive what it might be soiled with.
So even the heat from the dryer isn't
No.
doing any help.
No, I had, like I said, I was doing Google searches about how clean is your wash. I don't recommend looking it up because it's really not as clean as we had hoped or thought it would be. So, but I don't know that there's anything we can do about that, unless you go and get one of the newer washers and dryers that do have the sanitized cycle, and then they superheat the water and all of that jazz. And that can be effective, but not many people have those types of machines right now. So, yeah. Do most of your clients have washing machines readily available in their place where they live, whether it's in their apartment or whatever? Okay. So we're not transporting laundry out to a community laundry or anything like that? Okay.
Is that true? Like for
We do have
Roslyn,
some of
West
those.
Nor, all those places, those are all community machines.
Mm-hmm.
Yeah.
And then do you put the laundry in a basket, or how do you get the laundry to the machines?
Yeah, baskets. They have baskets in their homes.
Okay.
And I know Carla takes, isn't it Lynn, to a laundromat?
Okay. I think it's a little different in a community setting versus like at Berry House, but some assisted livings and nursing homes are supposed to transport laundry either in a laundry basket or in a garbage bag to the garbage facility or to the laundry facilities, so that you're not shedding things along the way. So you wouldn't want to take a big old armload of laundry and walk it down the hall and down the stairs. In a Roslyn apartment situation, you wouldn't want to be just carrying laundry. You're going to be transferring anything that's in that dirty laundry onto yourself. But then you could also be leaving it all along the way. Okay.
Well, and the regs for Berry House are that you're supposed to have it in a basket with a cover on it. So it's not like it could be like a regular laundry basket. It's supposed to be a covered container.
Yeah. Or I think a garbage bag works too.
Well, that would probably work.
I've seen a lot of people use a garbage bag as a vehicle for moving it. Yeah. And then some say and I'm not saying that you guys need to do this, but so if you've got a bunch of soiled stuff in the wash basket, they accidentally wet the bed or whatever, and you put that in the wash basket, you take it to the washing machine, you wash it, you dry it, and then you put it back in the wash basket.
Oh, I don't do that. I wash your basket out every
I was gonna
single
say,
time I do it. You have to.
Yeah, that's another thing that needs to be taken into consideration is should we be wiping out the basket then if they're using the same one?
It's nice at the Western because they have, in their recycle room, they have a hose.
Oh.
You can go in there and I just rinse hers out all the time. And dump the water back down the sink. So, it's nice there.
I certainly never thought of that.
I do with hers because I never know what's in there. She just throws her whatever in the basket. She's
Well, that could be the same for Mark. My God, I never know what that man said. But
So not hand sanitizing, but like Clorox wipes or like Sanicloth wipes. These are the ones that will kill all the germs except for C. diff. They won't kill anything that has C. diff on it.
what are the symptoms of the C. diff?
Profuse diarrhea, usually diarrhea, that has a pretty foul odor and lasts for days and days and days, weeks and weeks and weeks. Most of the time, the clients that you would see that end up with C. diff have been on antibiotic therapy for a long time, or they've been maybe in a skilled nursing facility or been in the hospital a lot recently. Those are key places to pick up C. diff. And because it's so hard to kill, because you need to use all these extra measures to kill it, it's unfortunately that much easier that it can be spread because conventional methods don't kill the germs. So,
Can't you also have these residents or clients or whatever you want to say make that bleach solution so it's right in the home,
Mhm.
and that's just as effective as all that stuff?
Yes,
Isn't it 1 to 4,
I think
the
so.
ratio?
I think so. Yes.
The bleach solution, what is that for though? Is it
Just
for
to clean
cleaning?
surfaces,
Mhm.
and instead of buying all these products that have got
Right.
names on them, they
Absolutely.
spend tons of money on,
Right,
you just
right.
do this bleach mixture, and it works for everything.
Yeah, and you can put it in a spray bottle from the Dollar Tree.
Yes.
Then you
Far
can
cheaper.
spray it on stuff. You can.
Well, I know the one thing that we were told was about the 99.9% alcohol with water to help keep away the bed bugs.
Yep. Bed bugs are another thing. Bed bugs scare me more than C. diff does, but because those are becoming so much more prevalent, and all of a sudden they're becoming immune to a lot of our treatments for them. So, yeah. Any other questions or things that we need to talk about right now?
I can't think of anything.
No. Well, thank you.
You're welcome.